Hello, everybody. How are you tonight? Happy Monday. This is Dr. Stephanie Stroud with Cornerstone's Pet Tip of the Week. And so it's summertime. It's kind of raining. We've had some storms. And I don't know about you guys, but I'm having like the worms crawl out of the ground and come onto my concrete on my driveway, into my garage, and they're just everywhere. And so that got me thinking of all the different parasites and worms that we see in our dogs and cats. Particularly the one I want to talk about tonight that I've seen in quite a few patients lately, that's very, very preventable, but that can cause massive problems when we don't prevent them, is actually hookworms. And so a lot of us hear worms and we just think, ew, gross. There's a lot of different types of worms, and the treatment and prevention of those different worms can vary. And so what are hookworms? So hookworms are actually a parasite that they live in the GI tract. So they live in the intestines. They live in the part of the body that absorbs food and so forth. And they can cause problems. And so they cause a lot of inflammation within the intestines. And the most common sign we see of hookworms is actually diarrhea as the first sign. Okay, but as you can imagine from the name hookworms, their mouthpieces are like hooks, and so they actually hook into the intestines, and what they feed on is the blood that we see in the system. And so one of the things that I commonly hear in several puppies that I've seen lately is that, yes, I've seen my puppy have diarrhea. It also doesn't seem to have as much energy, and its gums are really white. And of course, a lot of people jump to the thought of, oh no, my dog has parvo. Parvovirus is also an infectious disease that we can see in young puppies, and we talked about that on a previous video a few weeks back. And so you can definitely visit that. It's very important. And that's definitely one of the differentials, but it's completely different than hookworms, okay? You can have similar clinical signs, but they are different diseases. They're treated differently. That's why it's so very, very important when you get a new puppy to have them evaluated by your veterinarian so they can screen for some of these things. Every puppy or every kitten cat should, when they are checked out by their primary veterinarian, have an internal parasite screen. And basically we are getting a sample of the stool, and we're looking for hookworms, we're looking for roundworms, we're looking for different parasites that can live in the gastrointestinal system. And many times we can identify those and catch them early before they cause clinical signs. Oftentimes we're catching them before they even have diarrhea. And so that's one of the ways to prevent these things, is to look for them before they cause a problem. So again, when you get a new puppy or kitten, your primary veterinarian should be checking the internal parasite screen. Additionally, on a yearly basis, when you take your pet in for their wellness examination, it is recommended by the Center of Disease Control for humans that pets have a yearly internal parasite screen. So again, making sure that the preventions and the medications are working appropriately just like they should be. So that should be done on a yearly basis. Sometimes in puppies and kittens, if they are noted to have parasites, we as veterinarians will recommend they have a follow-up internal parasite screen to make sure that we've cleared everything. In the case of hookworms, though, when it's not identified or they're not noted, the signs again that you would see would be diarrhea. You might see that your pet's gums are white instead of pink like they should be, and you may notice decreased energy levels. And the scary thing is we tend to see blood in the diarrhea, so that can be very scary as an owner to see. And so if you see any of those clinical signs in your puppy or your kitten, you should be taking them to your primary veterinarian ASAP. Okay, when they do that, they're going to be able to do an examination first of all and identify, okay, what are we more likely to be exposed to? Are we more likely to be exposed to worms, or do we need a test for parvo, or what do we need a test for? Once they identify them, which again, we look at a stool sample under the microscope to identify those things, we can treat them. There are a lot of different dewormers, and so very often you'll hear from a breeder or a friend or anyone that you get your pet from that, oh, I've dewormed them, okay? Different dewormers cover different types of parasites, so not every dewormer is the same medication, and those since they're differing medications, they cover different worms. And like I already talked to you about, there's a lot of different worms out there, from roundworms to hookworms to whipworms to tapeworms, and the treatment depends on the specific worm. And so just because you give an over-the-counter dewormer does not mean that your pet is clear of worms. So your veterinarian will identify the type of worm and if you do have hookworms, and then your veterinarian will prescribe some medications. The good news is that hookworms is very, very treatable. In severe cases, if your pet is very sick where they're severely anemic because of the hookworms, and the hookworms have eaten so much blood that the patient has lost a lot of blood internally to these parasites, sometimes they may need to be hospitalized. But for the most part, we're able to treat them as outpatients. Typically, we'll see them back within a week and make sure we've cleared things appropriately, and then we can get them started on prevention. The most exciting news to me about prevention is that the preventions we have these days are so much better. And one of the things you guys know is near and dear to my heart that I always talk about prevention is heartworms. Heartworms are a different type of parasite. They actually live in the heart and are transmitted by mosquitoes, versus hookworms and roundworms live in the GI system. But the amazing thing is that these preventions, the heartworm prevention that we recommend, actually has coverage against roundworms and hookworms too. So by preventing heartworms with the medications we recommend, you're actually protecting your pet against hookworms and roundworms, which is excellent news. It makes me so happy that our preventatives now have multi-coverage where you don't have to worry about giving 3 or 4 or 5 different medications to protect your pet. And so if you are following the recommendations by the American Heart Association for pets and your veterinarian's recommendations of keeping them on prevention year-round for heartworms, you're going to have protection against hookworms and roundworms. Here at Cornerstone, we recommend ProHeart. It's an injection they receive, and it lasts for 6 months, so that when you and I get busy with our schedules and we forget to give our pet prevention a couple days late, we don't have to worry about them not being covered. They have the best coverage and the best protection by doing that injection and keeping them covered all 6 months long. And so that's the good news, and that's the exciting part, is by making sure you're following your recommendations by your veterinarian by covering for heartworms, you're also going to be covering against hookworms and those other parasites that we've just talked about. So that is all for today. If you have questions, be sure to drop them below. As always, if you want to watch any of our previous videos, you can find them right here on our Facebook page. You can also find them on our YouTube channel, Cornerstone Animal Hospital, or you can go to our website, www.cornerstonevet.info, and there's a whole about section, and you can actually find them under pet tips and under videos and then pet tips. But there's also a blog on there that talks about different other tips that we have not talked about on video, so be sure to check that out. It gives you a lot of different information. So I will see you guys next week. Thanks for watching. Bye-bye.